Linda, how can I help?
Feels like it's in my back most of the time.
Right.
Sorry, Craig's killing me.
Oh, dear. How many did you used to smoke a day?
30 to 50.
30 to 50
Yeah, when I was
a day.
smoking, yeah.
The right side of my skull is changing continuously. Hurts like hell. Touch it and I scream sometimes.
Each day I wake up, I think, oh, Jesus Christ, another day.
I don't like the look of the colour of that.
I don't like the sound of the pain either.
Oh, look at that sun coming out.
No, it's lovely, isn't it?
It's supposed to be all right, isn't it, now, the rest of the week?
It's supposed to be, isn't it? Yeah.
Hello.
Alex Slater.
Wrong end.
Come on this way. Well then, come on in. Come and have a seat. Hi.
I have some boils.
Right, OK.
Troubling me for some weeks now. I've tried putting magnesium sulfate onto them to bring them to the surface, but nothing's really
How long
helped.
have you had those for?
They've been going on and off now for a couple of years.
Have they?
Yeah,
Okay.
I had a 7-headed one, what, 3.5, 4 years ago,
Yeah.
on my bottom. That was very sore.
Yeah.
So that ended up having to be lanced. But I just seem to keep getting them. It's small when I shave.
OK.
And it's not sore when I shave, it's normal, but...
But then you get boils afterwards.
yeah,
Sounds like you've got an infection there. Should we have a look at it?
No,
is it?
that's
Is
fine.
it?
That's
is
fine. It's
Yeah.
Yeah.
But you're all right if we...
yeah, no, it's fine. Okay.
Can I come in?
Yes. Sorry.
All right, gosh.
What's brought you here today?
JJ has a temperature and he has a cough and he can't really speak very well because he's got a very croaky throat, as you can hear. He had a temperature about a week ago and it's been on and off ever since, hasn't completely gone away. I've been giving him Calpol, Nurofen, lots of water. He's been off his food and I just thought before the weekend comes, I need to get him seen to you.
OK, so his symptoms have been for about a week with the cough.
And the temperature, yeah.
Has it worsened, his voice worsened?
Yeah.
Is he coughing anything out?
No.
Right. Shall we look at you?
Should you take your jacket off today? Sounds like a little monster. Where does it hurt? Tell the doctor where it hurts.
I just need a little feel. Well done. Let's have a listen to your chest a moment. OK, so his chest sounds clear. Can we pop that on your finger?
Oh, yes.
Oh, you're going to do it. Well done, that's it. You keep it nice and still there and look at the
Watch
numbers
the
when
numbers,
they come
yeah?
up.
What's your
And
favourite
keep
number,
your
JJ?
head still.
What's your favourite number
Keep it
3?
nice
Is
and
that how old
still.
you are? What's your favourite number, Josh?
29.
That's a very unique number.
Can I have a little look in your mouth?
Just wide as you can. Just wide as. They did it.
As wide as you can. Good boy. Nice and...
It hurted me too.
I can't see any pus there. It sounds like he's had a viral infection, so there's inflammation within the vocal cords.
Right.
Let's just pop this one in your ear. It's not going to hurt, sweetie.
She's not going to shoot your ear.
Well done.
You're so funny, Josh. You're supposed to be calming him down.
That's fine, that's all normal. If after the weekend you're finding that he's not any better or he's worsening, then bring him back and we can review him.
So you don't
Or
think he
if
needs antibiotics
changes.
then?
Antibiotics won't treat a viral infection.
No. All right then. Come on then, JJ. Let's put your jacket on. OK, come on then, boys. Oh, careful, Jay.
Well done.
Hold
Yeah,
on.
I'm much stronger than you. I can open that easy, please.
Well done.
Oh, careful.
I can
Thank
run
you.
out.
Bye. Bye.
They're going all the way down and then
But they're always just on the outside. They're not actually inside your bits.
they've been going down that way, yes. And I have some. I've had a few on my bottom as well. Oh, but they're so painful.
Yeah, I can see that they are. That's fine. Do get yourself dressed up and come on out. OK, so those infections, those are little boils, as you say.
They are boils, aren't they?
Yeah, and
Okay.
they're essentially what's happened is when you shave,
Yep.
the
Hair follicle goes down instead of up.
and you get a little bit of infection around the base of the hair follicle.
Why
And
do they not want to come out?
Well, it's because of the shaving that sometimes then you get a tiny bit of skin growth over it, and it just means that it can trap some of the bugs in the hair follicle, and so it happens more commonly when you shave.
Right.
What we need to do is to try and reduce the amount of bacteria down there.
Right. What causes bacteria down there?
Well, it's actually we're all covered in bacteria all over our skin,
Right.
everywhere. Some wash just to help reduce the
Yeah, I use
bacteria there.
dermal when I wash.
Well, I'm going to try something that's a little different from that, just to see whether that helps settle it down. The other thing to do is just think about not shaving there, because obviously that will reduce the chance that you get the infection
There is
But
that point.
And if you're getting other infections, or you're getting this as an ongoing thing,
Yeah.
should we be doing any other tests? It's not unreasonable to check your blood test, as I say, and then we'll see what's happened when we've got the tests. You don't get any under your armpits or anywhere else?
No, I use a different type of razor. I use Bic for there and electric for there.
OK. Blood test you can book in as well, and then I'll see you with the result. All right?
Yeah.
All right. Cheers then.
Thanks, Dr. Kelly.
Bye-bye.
Bye, darling.
3 trips for older people.
Where are we going?
No, I'm just part of the Bristol Aging Better project, offering older people the chance to benefit from day trips.
What are you looking at that for, Jackie?
Well, because I'm an older person, yeah. We're trying to work out where we're going.
Come in, I'm Dr. Gosh. Do you want to sit down?
Thanks. I'm having problems sleeping. I got this thing where when I get up in the morning, as soon as I wake up, I feel so sick. And I got to get out of the bed because I think something bad's going to happen if I stay there.
Right.
And this has been happening for quite a while.
Okay.
So I've been treated for depression.
Yeah, I saw that, yeah.
But now I'm not even going to bed, I'm just sleeping in the chair.
Oh, dear. So what exactly happens when you try and go to bed? Do you get to sleep to start with?
No, as soon as my bum hits the bed,
Right.
I feel sick.
But what are you sort of worried about? What do you feel like?
I just think if I stay there and try and go back to sleep, I think something terrible's going to happen. I'm the eldest of 11 children.
All right.
But I've had 3 siblings much younger than me die in the last 3 years.
Right.
And I'm a widow. I've been a widow now 26 years. And it gets harder.
I'm sure it does.
People say, oh, time's a great healer. It's not.
Still very lonely, isn't it, for you?
I've wanted to die for the last 26 years.
Have you?
There's a bit of wear and tear there.
It's old age.
It's not old age.
I've tended to slow down.
No.
Playing football.
Getting old now, 92.
You're looking very good on it.
Oh, I don't know about that.
You look from this terribly fit and healthy.
Yeah, I am terribly fit and healthy.
God, are you really 92?
I am, sweetheart.
You look fantastic.
Thank you. 93 in September.
Whoa, that's fantastic.
I would not do something to promote my own death, because I would not want my children to go through what I went through.
Yeah, sure.
That is the only thing that stops me.
Sure.
So
Sure.
each day I wake up, I think, oh, Jesus Christ, another day. You're here whether you want to be here or not.
Yeah, sure.
Must be a reason for it.
Well, there must be a reason for it, mustn't there?
Yeah. Just bug a lot of people on the way.
What do you think would help with all of this? I see you've tried some antidepressants in the past, haven't you?
I did, and oh God, they made me so bad.
You didn't really get on with them at
No.
all, did you? I mean, it sounds to me, there are a lot of groups that can help people who've been feeling down or struggling a bit.
Yeah.
And if you're the sort of person, particularly who is quite sociable by nature, you might really find that helpful. Would you like to give that a go?
I don't think so.
You wouldn't?
I'm not ready for the lunch with the old people. No.
The other thing is, have you met Heather, who's one of the receptionists here?
She got me, and I was going to do some voluntary work.
Yeah. Can I ask Heather to give you a ring again and
You can.
see what else she can do? Because I think
there
it's
must be
more.
something I
I
can
think
do.
it's something you need to do, isn't it? Because I think
know
it's
my-
more the social side of things, really.
The falling asleep. I wonder, could I have a blood test to see that I'm not anemic? I've always had it.
Oh no, you did. You had one in March.
Yeah. It
It
would show up if I was...
was slightly borderline. It was just about all right. Let's check again and make sure you don't need any iron tablets.
Yeah, that's what I'm thinking,
It's just
because
occasionally that
over
can-
the years I have had to go
yeah,
on.
Yeah, and that can give you problems sleeping, definitely. Yeah,
exactly.
Okay, so book in for that, and I'll ask Heather to have a chat with you.
Okay.
Okay.
Oh, sorry you had to get me on.
That's all right.
The sun was shining over the nursery courtyard.
What's a courtyard? A field.
What's a courtyard?
Is it a field?
Courtyard.
Is it like a field?
It's in a playground now.
Yeah, it's like big concrete.
Okay.
Yeah.
You're a new patient here?
Yes, been overseas,
Right. And where have you been?
all over Africa, and the last 3 years was Sri Lanka.
Right. Very nice.
So moving around.
What were you doing?
I'm a minerals person, so I'm scratching around looking for gold and diamonds normally.
Right.
Haven't
You're not
found
from the
enough yet because I'm
UK.
still working. So.
Yeah. And you're not from the UK originally?
No, I am. I'm fully
Are you?
English, but
Right.
not many gold deposits around Bristol or diamonds or a bit of coal in South Wales. Used to be some tin in Cornwall.
Okay.
So
So what have you come for today?
the main one I actually want to come at is I've had a lot of sun.
Yeah.
And my brother had very bad melanoma, stage 4. Very lucky to still be around after 6-7 years.
Right.
And so I've had lots of things burnt off me, taken off me.
Yeah.
I now have this thing on my head, and of course, coming to a doctor, it's the smallest it's been in 7 months.
Right.
It looks a bit weird. It comes and goes. It bleeds a bit.
Right.
It gets bigger, smaller. So I basically wanted someone to look at that.
Okay. All right. So I'm just going to look at it with a bit of light and some magnification. Okay. So it's a raised lump with a little dip in the middle. It is a bit sort of pearly. So there is a small possibility that that is not a malignant melanoma, but a different sort of skin cancer.
And sometimes if I just scratch it the tiniest bit, it'll bleed and run down a fair bit. And
Yeah.
I believe that's not necessarily...
So it's 6 millimetres. I think it'd be reasonable to go and see somebody about that. There's an urgent referral where you'll get seen within 2 weeks.
I'm actually going away right now
Yeah.
for 13 days.
Okay. Right. So
I would
they'll
like to have
see
done it
you-
urgently, you know, but
Yeah.
I took a
Okay.
while
Well,
to
hopefully they'll just see you
after 2 weeks.
after that. Yeah. Have you actually had skin cancers removed?
I've had, I'm never quite sure, carcinomas, basal
cell carcinoma.
Basal cell carcinoma. Does that classify as a skin cancer?
Yeah.
It is, isn't it? Yeah. I think I've had 1 or 2 chopped off.
You're going to be in the UK?
No, I'm going to Italy for 13 days,
Right.
basically. I'm actually going to leave now. Our taxi's coming in half an hour.
Right.
45.
Okay. I'll put it at the front desk in an envelope. You can pick it up when you get home, okay, from your holiday. Okay.
Thank you, Doctor.
That's all right. Bye now.
How are you today?
Good, thanks. You?
Yeah, not too bad. The sun's come back out, so I'm happy with the
Oh,
sunshine.
good. You're going to have some time after your shift to play with it.
Well, I'll be home about 7.
Oh.
Does Sally want to sit over there? I was just getting you
Yep.
a seat, sir.
Oh,
Sorry,
thanks.
I don't know your name. So.
Keith.
Keith, hello, Keith. I'm Linda.
Hi, Linda.
And what's your name?
Thanks. This is Lily.
Lily. Hello, Lily. And which side do you want the injection?
Maybe the left, because I'm right-handed. That makes
Okay.
sense. Turn around.
That's fine then. You go that way then, Lily. That's right.
Is that enough room to get
That's
whatever
fine.
you need?
Only want the top of your arm. So I'm giving you a booster of your tetanus. We talked about it on the phone, didn't
Yeah.
we? Tetanus, diphtheria and polio, all in one. Sally came to see me because she needed some travel injections because she is travelling to Chicago in September to compete with the Great Britain blind sailing team.
I said what I was doing, didn't I?
You did, yeah. Wow. Exciting, isn't it?
Yes. I've just got to deal with the training now.
Sally was born with normal vision, but when she was about 6 years old, she contracted an eye condition called uveitis, which has left her with only 5% of vision. Is the training based in Bristol?
Some of it is. So we've just come from the swimming pool, actually, done 30 lengths. And yesterday I was doing some quite evil core fitness training to simulate racing a boat. So pulling a 40-kilo tyre around the gym.
Right, okay.
And then tomorrow I'm off to UK Sailing Academy to train with the Great Britain squad. So we'll be on the boats at sea. So.
Wow. And where's that? Portsmouth or something?
It's Cowes in the Isle of Wight.
Yeah. Nice. And you're going to have nice weather for it as well, so it'll be lovely, wouldn't it?
As long as there's wind, we don't care what else there is. But if it's sunny, that's an extra bonus.
It is, isn't it? I should think so too. So you OK with needles?
Yeah.
Yeah, all right then. I'm just going to pull your sleeve up a little bit there, Sally, all right? Here we go then, sharp sting. There we go, all done.
Great. Is that all right to put down,
All right, that's fine. So that would last, in theory, 10 years.
Great. Thank you for fitting me in so quick, thanks.
OK, that's a gold medal, won't you?
A gold medal. No pressure, no pressure.
No pressure, no pressure. Just a gold medal. OK, nice to meet you.
And you.
Bye-bye,
Thanks, Linda.
You too. Bye-bye.
Bye.
Oh my God, look at these. Oh, these cakes look amazing.
I very rarely eat cake, and so it has to be really good before I bother.
Rarely eat cake.
Well, these are always good when Heather does them.
George Anderson, please. Hello, George.
Hiya.
Sorry to keep you.
That's all right, I was late myself, actually.
It's all worked out then.
Yeah.
Come and take a seat. How are you?
Extremely tired. I'm exhausted all the time. I don't know what's going on, but the right side of my skull is changing continuously. It's getting big bumps, big dips, hurts like hell. I have no idea what's going on. I haven't banged it or anything, but it's completely deformed. There's not an inch that is smooth, and it hurts. Touch it and I scream sometimes.
Okay. How long has this been with you for?
Months.
Okay.
It's months. Yeah.
Let's just have a look and see what's going on.
Yeah.
Have you found any bits that are itchy or any particular spots?
But they change continuously. Every day there's a new, and it's not like swelling because it's really hard. It just feels like the skull itself has gone over.
Well, there's nothing to be concerned about in the sense that there's no skin lesions or scalp lesions because some people get cysts or other things or spots or
Oh, no, it's a very
something or
different kind of pain than the cysts.
But,
like.
I mean, it all feels like a normal, it feels normal to me.
Really? And this really gets me, especially in the evening, it starts to hurt. And I'll just brush my head or just touch my head and I'm just like shocked at the amount of pain that there is. And I start touching and I find all these painful spots.
So it might be what we call dysesthesia, or it's an altered sensation.
Yeah.
It's almost perhaps some kind of superficial nerve thing going on. But I think we'll just watch that. George is currently 59. He has quite a few complex medical health problems. He suffers from cluster headaches. He's hepatitis C positive and HIV positive. HIV, if it's caught early, is no longer a death sentence. In fact, people can live a near normal lifespan because there have been significant advances in the medicines used to control the rate of growth of the virus. I'm pleased to say that currently George doesn't suffer from any issues related to his HIV. It's well controlled. However, unfortunately, he has also been under significant stress recently, which has led to anxiety and low mood symptoms.
I didn't take the antidepressants at all.
Okay.
I made a conscious decision that because they take so long to work, and there's certain things that, they basically castrate you. I mean, your sex life just disappears. And that is one of the only things that actually keeps me alive and happy a little bit. And to eliminate that would be just dramatically wrong.
If you're happy not to start that, that's fine.
I need my faculties, and I actually need a little bit of extra emotion to get through something instead of just kind of letting everything just, which is what happens a lot of times.
That's quite a valid point, actually, because sometimes some people can feel a little bit subdued on them.
Yeah.
You're not vomiting? You're not waking up at night with headaches?
Not those headaches, no.
No. And no symptoms on your face or in your jaw or in your mouth?
No. No.
All right. Well, you're going to be due some tests and things when you go to the Brecon unit next week, but maybe we could touch base in 6 weeks or so, and you can keep me posted.
Yeah.
Obviously, if anything bothers you before that,
Yeah,
then
sure.
come in sooner.
Sure. That's it. Yeah. Good.
Nice to see you.
Likewise.
Take care.
You too. Enjoy the weather while it lasts.
Laura Smith, please. Morning. All right. Just while I remember, I've got a message on my screen saying, can you go to reception after you've seen me?
Okay,
There's some message for them to discuss with you.
Yeah, all right, lovely.
Okay.
I'm just happy I got an appointment, to be honest.
OK, what can I do for you?
So this pain, I've been getting it, my last 2 appointments,
Yeah,
I had this spot of pain complaining about. I finally got my ultrasound tomorrow. Which is like a light at the end of the tunnel, but today it's the longest I've had an attack for. It's like, woke me up at like 5 o'clock.
What's the pain like?
Stabbing, I would say. Feels like it's in my back most of the time.
Right, OK.
But then it's also down here. Sorry, Craig's killing me.
Oh, dear.
Sorry.
That's all right.
I don't normally get weepy, but I think it's because I'm not
does it?
sleeping.
Yeah.
But hence why I made the appointment, because I haven't ever gone 3 hours in that amount of pain. Tramadol isn't doing anything. My mum has been giving it to me since it started.
Right.
But and I'm also concerned, what do I even do once I've had the ultrasound? How do I find out? Because I just want it gone. I don't know what it is.
OK.
Before I forget all about it and go home with it,
Oh,
there
right.
is a pot of my wee for you. I brought you a
Great.
gift.
I got my sample.
Oh, smashing. Cheers. I'll take that.
Wee-wees.
Yes, it's our wheeze.
I have these kind of days, dipsy days.
Is that enough?
Yeah. If you're able to do that in the treatment room, that would be great.
It'd be marvellous. It'd be a miracle. I've just been...
Oh, have you?
So I haven't ever gone 3 hours in that amount of pain. And I don't know what I'm doing to kickstart it. Or... This is what the ultrasound's for, I suppose.
Yeah.
When I was saying I think it's gallstones, and I'm thinking, well, normally food or something kicks that off, and I'm not doing anything to start this pain off, so...
Right. When you get the pain, you use tramadol.
Yeah, but I'm taking tramadol as more of like a prevention.
Right.
Because it's pointless taking it when you're having the attack.
And when you're taking it, how many are you taking?
I'm only taking 2 a day because it's making me constipated.
Yeah. I think rather than taking it to try and stop it coming, I think we need to try and take it when it comes.
Really?
Yeah. I just want to have a little look at you. OK, if you jump up on the bed for me to feel your tummy. So have you got the pain now?
I can feel it in my back,
In your back.
but it's more of a niggling. It's not like the agony that I'm getting.
I'll just have a little feel around. OK. It's all there.
Yeah.
Isn't it? Yeah.
Sorry, I tense up.
That's all right. That's fine.
Yeah.
OK. Would you mind just doing a urine sample, just to check we're not missing anything from your kidneys?
Yeah, if I can get anything out.
So if you go and do that now and come straight back in.
Yeah. That's literally all I got, I think.
Yeah, that's fine. That's all I need. OK. Have you got your period at the moment?
No.
No. OK. So it's 2 platelets of blood in here. I don't think it's a urine infection, but I'm going to send it to the lab just to be sure. OK. One of the things that can cause sort of loin pain, pain going through to the back, is kidney stones, and that can cause blood in the urine. OK. So I think what we need to do is wait for this scan tomorrow. Yeah. If it shows gallstones, fine, then we refer you to have it removed.
OK.
If it doesn't show anything, I think we'd then need to consider, do we need to do a CT to look for kidney stones?
Yeah.
In the meantime, I can give you a small supply of tramadol, but like you say, they are very addictive and they do cause constipation.
Yeah.
OK. The other thing I could give you that does work very well for gallstone-type pain is a suppository. So I don't know how you'd cope with that, how you'd feel
I'm
about
fine with that.
Good.
But if it's lasting this long, Oh, sorry.
It's all right.
I think I needed a bit of a rant as well.
That's OK.
Yeah. Thank you.
No problem.
Thank you
OK,
so much.
no problem.
Have a nice day.
You
all
too.
right.
Bye-bye.
Slapped a cyclist.
Oh no!
I stood right for my bus and I'm looking up the road and the bus is coming down the road and...
Oh, and you put your hand out?
And I put my hand out and I went like that.
Ah!
But he was
Did you knock
coming.
him off his bike?
No, he was pushing his bike up the road on
Hello.
the wrong side of the road.
Well, there you go then.
You had a nasty injury, didn't you?
I did. I've just been up to see the consultant. He's just taken the stitches.
OK. It was a bike accident?
Yeah, came off the bike and displaced the shoulder, so they've put it back. I went for a CT scan at the RUH, and that was why I was coming back, really, because they said you might want to go see the GP just to check. Because I told them that I get these really bizarre headaches, but I get a line across my eye. But it's not blurry, it's just a complete blackout of half of my eye. Not two, it's only usually the one, usually the left.
OK, because that's an unusual pattern for a headache or a migraine or anything like that, because normally the headache or a migraine, what you're talking about is a loss of a field of vision, and it will be the same field irrespective of which eye is open.
No, it's not.
How long have you had the headaches for?
This has been going on months and months.
How often do you get them?
Probably 1 or 2 a month.
How long do they last for when you get them?
The intensity lasts about 10 minutes, and then I'll either go to sleep and try and sleep it off, or it tends to just fade off.
Do you feel sick with the headache?
Sometimes a bit
Do you
sick.
actually vomit
No,
or not?
no.
That's migraine, my book. OK,
Yeah,
so a visual warning,
Yeah.
followed by a nasty headache
that's what I
with some
assumed,
nausea. That
yeah.
sounds like migraine.
Yeah.
OK. So one of the problems with doing CTs of people's heads, and you might do it for one reason,
And find
it
something
finds
else.
something else. We call this the vomit syndrome. Vomit stands for victim of medical imaging technology.
OK.
So this might be the vomit
All right,
syndrome,
yeah,
I'm
that's
afraid.
fine.
So this is an important bit. So there's no bleed inside your head. Grey matter and the white matter looks normal in the head, so that's,
Yeah.
the thinking material. Down at the base of the skull, they're saying that there's something that looks a bit funny, and it might be it's a blood vessel that's slightly enlarged, or by lacunar infarcts, they mean a type of stroke.
What are we talking about?
I've had a slightly bad back for a few months. Sort of stiffness, stuff like that. Nothing too major, just, you wake up in the morning and it's always kind of there.
Yeah.
But then a week ago, last Sunday, I played cricket on Saturday, felt fine, and then on Sunday morning I woke up and couldn't tie my own shoes, never mind do much of anything.
Sure.
And it's been like that for about a week now.
So you've had the stiffness in the back for the last 6 months or so?
Yeah, I think it's a long-standing, 6'3", lanky, don't sit in chairs properly, bad posture all my life and all that kind of stuff, and it's just finally caught up with me. And then I changed jobs last year, and I think I just didn't have a very good setup at work. The wrong chair and this, that and the other for a few months, and it's just kind of brought everything to the surface a little bit.
But the stiffness is different from pain, or...?
This feels different. It feels like an injury, like a muscle tweak or something.
Sure. And let me just double-check, the pain's just in the back, it's not radiating into the legs?
No, it's all lower back. The general stiffness I've had from a few months tends to be lower back, but depending on how I sleep and stuff, it can be a bad neck and other things.
Let's just lift this leg up. No weakness or numbness or tingling?
No, not that.
And peeing and pooing normally? Just checking the nerves are all OK. Stand up for me. I'm just going to press all here, if that's all right. Is it sore in the sides?
It's not sensitive to touch or anything like that.
Is it sore in there at all?
No.
Just touch your toes for me.
Not a chance.
Are you quite inflexible?
I'm fairly inflexible anyway, so there's no chance I'd be able to
stay sideways and just
my toes, but
just
quite
bend.
Whereas I get to about there and it starts to hurt, and if I go much further, it's going to.
Would that be your normal range of movement, do you think?
No, it's a little bit. Well, I'm somewhat inflexible anyway, I have to admit.
Sure. And in terms of, I'm just looking at your medicines, you're not on anything regularly?
No, I've been taking ibuprofen for a few days.
Yeah. Well, do you want me to give you some stronger anti-inflammatories then?
That might be worth trying.
OK, well, let's try that. I think that it is likely that you've just tweaked it. There's no worrying signs of it being affecting the nerves, which is the medical worry for back pain, so I can just reassure you that it should all just settle down. So that's what's happened just in the last week. In terms of the last 6 months, though, I'm hearing that it may be that this is a stiffness problem and that there may be some underlying issue there. Now, there is a condition of stiffness in the morning that affects young men and causes back pain.
Okay.
And I think if you've been having that, then it would be a reasonable thing for us to check a blood test and an X-ray.
By all means, yeah.
The condition is called ankylosing spondylitis, which is an inflammation problem, and that's the thing that we just need to make sure that isn't there.
Okay.
And, you know, it's quite likely that that's not going to be the case, but I'd just like to make sure that we get the blood test and the X-ray, and then get you back in to see your own doctor with the results of those tests in a few weeks' time.
Yeah.
All right. If any other problems in the meantime, then let us know, but I think it will all just settle down with that plan.
Okay, great. Okay, great.
Cheers. Hope it settles down.
Cheers.
Bye.
I would be astonished if you'd had stroke, really. I mean, it seems really unlikely. You're very young, you're very fit, you're very healthy. There's no reason why that should have happened. What we do need to do, having got that report, is just do a quick neurological examination and get blood tests and check your blood pressure to make sure you've got no risk factors for developing a stroke. Okay?
Yep.
Let's do the blood pressure first, actually. Is this all making sense?
Yeah.
Let's put it round here. Yeah, OK. Have you been back on your bike since?
No, I did ask, and he said, I prefer you not to go on for at least 6 weeks.
Okay, that sounds sensible.
Yeah.
So that's a normal blood pressure. OK, so that's very reassuring. OK, I'm going to shine some lights in your eyes next. We'll turn the main lights off for this. So we're looking for the nerve head, if it's bulging or not. That looks absolutely normal. That's fine. OK, a bit bright suddenly. OK,
Yeah.
so look at me, and I want you to follow my finger with your eyes. Do you see double at any stage while you're doing this?
No.
I want you to raise your forehead up. Close your eyes tightly. Don't let me open them. That's fine. Show your teeth. Blow out your cheeks. So I'm just going to feel both sides of your face. I want you to tell me if it feels the same on both sides.
Yeah.
Feel the same? OK. Just squeeze my fingers as tight as you can. The neurological examination is normal.
Yeah.
The blood pressure is normal. We should just check some blood tests looking for other things that can predispose to stroke. So we're talking about raised sugar levels.
Yeah.
We're talking about your cholesterol level.
Yeah.
I imagine it's all going to be normal. It would still be good to just find out a bit more detail about the headaches. I'd like you to just clarify the visual symptoms a bit more and let me know after you've had the next one.
Yeah.
I'd like you to keep a diary of when it happens, and I'd like to know a bit more about where in the head it is when you get it. All right? You can give me a ring to tell me about a bit more about the migraine once you've
Yeah, I will
had
do.
another one.
All right, yeah,
Okay.
thanks then.
Sure
Yeah,
then.
thank you.
I hit my knee like that, but look, Lynn, it's a big lump already. And I said I might have to come in on crutches tomorrow. The patient said to me, you need a doctor. I went, they're too busy for me.
Have a seat. So I'm presuming this is about your leg.
It is, yes.
Because it's a bit of a mystery, really, isn't it?
Yeah, have the scan people sent the information?
Yes, so they said there's no sign of a clot.
No.
Which is good. Yes. Possibly early cellulitis.
It's just got worse. By the end of Saturday, it was extremely painful. And now the pain goes from the toes all the way up to the top of my thigh.
Right, so where is the pain?
It starts off because I've got pins and needles in the toes anyway, it can hurt.
And what's that from?
Don't know. When I drove home from work Sunday night...
Have a look at the other one.
I struggled to feel the clutch. It's old colour now, isn't it?
It is. That's exactly what I'm thinking.
Isn't it weird?
How long's that been for?
The last 24 hours, I suppose. Looking for a pulse. Yeah.
I'm pretty sure I can feel a pulse.
Yeah.
Yeah?
That's good.
Yeah, it is good.
It's good news. It's alive.
I don't like the look of the colour.
No.
What I'm going to just do is see if I can find a nurse to just check. We can hear a pulse as well. Right. OK. OK.
I'm feeling quite hot again now.
Sorry?
I'm feeling quite hot
You're
again.
feeling hot. Come in.
Hello.
Thank you very much.
Hi.
Hi there.
So he's had pain and swelling in the leg, and we've ruled out a DVT, but it just looks a different colour.
Yes, it looks very pale, doesn't
Yeah.
it?
I think I can feel them, but I'd just like to hear it. That's all just doing that, is it?
That's all right, sorry.
All right, huh?
That sounds right, doesn't it?
Yeah.
That's good news.
Fine, all right.
Thank you.
Just reassuring, isn't it?
Yes.
Fantastic, thank you. Right, OK. What I want to do is ring and speak to one of the vascular surgical doctors. I don't like the look of the colour of that. I don't like the sound of the pain either.
Do you smoke at all?
I do.
Any plans to stop?
I want to. I tried those chewing gums, they're disgusting.
All right.
And when I
give up smoking, I become a very quick lose temper. I'm like a Spanish bull, having head down, going.
Smoking. Do you smoke?
Yeah, I want to quit smoking, actually. I hate smoking. It's a waste of money.
It's a waste of money.
You are a smoker.
Sort of. I'm not really a proper smoker. I just smoke occasionally, sometimes, when I'm stressed.
You started smoking again? How many a day?
Not many, actually. 3.
Oh, you can stop that.
But it's that craving.
It is that craving.
It's like gambling.
So I'm going to quit the smoking.
We've got to grab you while you're keen.
Yeah.
Now's the moment.
Bit out of puff, aren't you?
I am, yeah.
Why are you here?
Yeah. About a fortnight ago, I had a bug, bad, sweating. My chest has just got slowly worse and worse and worse. And last night I just more or less sat up all night just coughing.
Right.
Breathing's difficult as well. I'm trying to cough to get some up, nothing's coming up. But I can feel it rattling. Excuse.
OK, have you got any history of any breathing problems?
No, never.
OK, do you smoke at all?
No.
Have you ever smoked?
Yes. 12 years ago.
You gave up 12 years ago? How long did you smoke for?
Since I was about 15, 16.
Have you noticed yourself wheezing at all?
Yeah, I am wheezing.
And how many did you used to smoke a day at the most?
30 to 50.
30 to 50
when I
a
was
day?
smoking, yeah.
How do you find enough time in the day to smoke 50
I used to work
cigarettes?
on the markets, so you get there at
Just
6 o'clock in the
constant
morning.
train. Fair play for giving up then, well done.
Yeah.
What made you give up?
Grandson coughed watching Thomas the Tank Engine in front of me and had a fag in my hand, and I said, that's it, finished.
He coughed in front of you from you smoking?
Yeah, and I stopped.
Right, so we have this thing that we call pack years. So we work out your smoking history based on the number of pack years of smoking.
Yeah.
So the calculation is based on 20 cigarettes a day. So if you smoke for 10 years and you smoke 20 a day, that's 10 pack years.
Yeah.
OK, so let's average at 40. So you've got 68 pack years of smoking.
Not proud.
That is very significant
I know.
smoking history.
Yeah.
So anybody who's smoked for a long time has a significant risk of something called COPD, chronic obstructive pulmonary disease. So it's basically where you've got permanent damage to your lungs. It makes you a lot more susceptible to chest infections and things like that. So pop your finger in there for me. Let's check you over now anyway. You look quite well, so hopefully it's not anything sort of like pneumonia or anything, but I'm going to have a listen to your chest. Right, have a stand up for me. Right, can we lift your T-shirt right up? Right, nice deep breath. So have a listen at the back. Try and touch your elbows together in front of you. OK, so you've got some crackles lower down on this right-hand side. I think you've definitely got a bit of a chest infection.
Yeah.
It would be wise if we give you some antibiotics.
Yeah.
And then once that's clear, you need to come back and have a review of your breathing again.
Yeah.
And if you're feeling worse at any point, rather than getting better, make sure you come and see us again.
OK, thank you very much.
That's really helpful. Thank you for your help. Yep, bye-bye. So he was really helpful, the vascular doctor. He says the colour can alter and be very pale and dusky just from the swelling, and the fact that we've got the pulse means the blood supply is OK. So that's
good.
That's good news.
Good news, yes.
Can I have a quick feel?
Yeah, of course, yeah.
If you can lie on the bed, that'd be good. Where does that hurt?
Hip.
Hip. OK.
I can lie down. Hang on.
You all right?
Back of the ankle now.
OK. Right. All right. You haven't fallen at all? No. OK.
I wish I had.
Yeah. Can we bend your leg at the knee? Yeah. And no. Where does that hurt?
Muscle that goes all the way up to my bottom.
All right. Up you go. With Raymond, we'd ruled out a clot in the leg, which was an important thing to do. But when I examined him on the bed, he could barely move his legs at all. He was obviously in significant pain. I was concerned there was either some hip problem going on or a problem with the lumbar spine. I think we need some more imaging today. So I think the best way of doing that is going to A&E.
Suss it out.
Right. I really hope they help us get to the bottom of this.
It would be good. It would be really good.
It would be good, wouldn't it? OK.
Thank you very much.
That's all right. OK.
OK, thank you. Thank you.
All the best. Bye-bye.
Thank you.
No, you made me laugh. I don't know why I'm laughing.
Oh my God, I've just been sat in the waiting room laughing my head off. My sister put a photo of me on Facebook and eating a chicken carcass. And one of my friends said, "Is that a rat?"
Well,
And I said, "No, it's my sister." Oh dear. Anyway, right.
Well, good. I'm glad it's keeping you amused this morning.
Oh my God, it's so funny. I just have to show you. Hopefully, it'll make your day.
It is quite a photo.
Oh my God. Sorry.
It's fine. It's fine. Keeps me going.
This is great.
How are you getting on?
My knees are, on the whole, a pain.
Sure.
Still very painful. So at Christmas, I had pain in my right knee.
Yeah.
Which then got better.
Yeah.
And then I had a very bad acute pain in my left knee.
Yes.
And that is what is giving me most of the problems.
Right. And we referred you for the MATS referral.
Yes.
And they will look at both. Now, the right knee was the one that showed bad arthritis changes in the scan.
Yes.
And a little bit of wear and tear of the cartilage in the middle of the knee. Sometimes that can get locked in between the middle of the bones of the joint and cause your knee to lock and get stuck in one position. And that sometimes then needs them to trim it away and clean up the inside of the knee with a little operation. Whether it will need you to have a scan on the left-hand side as well will be down to what the MATS team say when they see you, I would suggest.
I would say generally it is getting better,
Sure.
but it's really affecting my life.
I think there's a difference between the two things that are happening, because one, we know that you've got really bad arthritis, and that's a different thing that's causing the pain from the thing that might be causing the locking, which is the cartilage
Oh, right.
problem. So let's boost the painkillers, wait for the MATS referral. I'll see you in about 4 to 6 weeks when we've got that, and I'll organise the scan.
Yeah, that's absolutely
But please
fine.
let me know if things get worse or you're worried or something else, all right?
OK, yep, that's absolutely fine. Sorry about my entry. My goodness, that's right.
Don't worry. Keep me going all day.
Good.
See you later. Bye.
Thank you.
Nice to see you.
You love.
Take care.
See you again as and when.
Bye-bye now.
Ta-da.
You say thank you?
Have a nice holiday.
Yeah, thank you.
Enjoy the rest of your day.
Thank you. Bye-bye.